Which structure is primarily responsible for the production of cerebrospinal fluid? तो राइट आंसर है इसमें choroid plexus. The choroid plexus is a network of cells in the brain ventricle that produce CSF, providing cushioning and maintaining the brain environment. What is the primary role of aldosterone in the body? Regulate sodium and potassium level. Aldosterone increases sodium reabsorption and potassium excretion in the kidney, helping to maintain blood pressure and fluid balance. Which of the following is a side effect of ACE inhibitor? Hyperkalemia. Right answer है ACE inhibitor can lead to hyperkalemia due to increased aldosterone level, which reduce potassium excretion. Which bacterium is primarily responsible for causing peptic ulcer? Right answer है Helicobacter pylori. H. pylori is a gram-negative bacterium strongly associated with the development of peptic ulcer.
बड़ा नुकसान यही है, मेंटेनेंस इतना.
अगला क्वेश्चन है विच ऑफ द फॉलोइंग कंडीशन इज कैरेक्टराइज्ड बाय द प्रेजेंस ऑफ caseating granulomas. तो राइट आंसर है ट्यूबरकुलोसिस. Caseating granulomas are indicative of tuberculosis, where necrosis occur at the center of granulomas. Which vitamin is a cofactor for the enzyme pyruvate carboxylase? Right answer है vitamin B7 biotin. Biotin is essential for carboxylation reaction, including those catalyzed by pyruvate carboxylase. The presence of cigarette burn in forensic pathology typically suggests child abuse. Cigarette burns often indicate intestinal harm, commonly seen in case of child abuse. What is the primary defect in myopia? The eye is too long. Myopia occurs when the eye is elongated, causing distant object to focus in front of the retina. What is the most common cause of primary amenorrhea? Turner syndrome. Turner syndrome is a leading cause of primary amenorrhea due to absence of normal ovarian function. Which of the following is a common complication of cystic fibrosis? Diabetes mellitus. Patients with cystic fibrosis are at increased risk of developing diabetes due to pancreatic damage affecting insulin production. Which of the following is the primary site of drug metabolism in the body? The liver is the primary organ for drug metabolism where enzyme modify drug for excretion. A patient present with a butterfly rash on the face, which condition is most likely? Right answer is systematic lupus erythematosus. A butterfly rash is characteristic of systematic lupus erythematosus, an autoimmune condition. Which of the following is a common manifestation of hyperthyroidism? Right answer is tachycardia. Hyperthyroidism often present with symptoms like tachycardia, weight loss, and heat intolerance. What is the most common type of breast cancer? Right answer is invasive ductal carcinoma. Invasive ductal carcinoma is the most prevalent form of breast cancer arising from the milk ducts. Which electrolyte disturbance is most likely to occur with prolonged vomiting? Right answer is hypochloremic metabolic alkalosis. Prolonged vomiting can lead to the loss of hydrochloric acid, resulting in hypochloremic metabolic alkalosis. Which imaging modality is best for evaluating acute pancreatitis in children? Ultrasound, right option. Ultrasound is preferred in children due to its safety and ability to avoid radiation exposure. Next question is, which of the following vaccine is a live attenuated vaccine? Right answer is measles, mumps, rubella. Measles, mumps, rubella vaccine is a live attenuated vaccine, meaning it contains weakened form of the viruses. नेक्स्ट क्वेश्चन है ए मून appearance is commonly associated with which condition? तो राइट आंसर है कसिंग सिंड्रोम. कसिंग सिंड्रोम इज characterized by the excessive cortisol level leading to a rounded moon face. अगला क्वेश्चन है विच ऑफ द फॉलोइंग इज ए कॉमन ट्रीटमेंट फॉर एनाफाइलेक्सिस. तो राइट आंसर है एपिनेफ्रिन. एपिनेफ्रिन इज द फर्स्ट लाइन ट्रीटमेंट फॉर एनाफाइलेक्सिस हेल्पिंग टू रिवर्स सीवियर एलर्जिक रिएक्शन. अगला क्वेश्चन है विच ऑफ द फॉलोइंग इज ए क्लासिक साइन ऑफ रीनल फेलियर. तो राइट आंसर है हेमेचूरिया, प्रोटीनूरिया और एन्यूरिया. हेमेचूरिया, प्रोटीनूरिया एंड एन्यूरिया all are the sign that can indicate renal failure. Next question है which of the following is the most common cause of iron deficiency anemia. Subset chest pain and shortness of breath. A chest X-ray reveal a mediastinal shift. What is the most likely diagnosis? तो राइट आंसर है न्यूमोथोरेक्स. ए mediastinal shift on X-ray where air trapped in the pleural space. अगला है विच कंडीशन इज कैरेक्टराइज्ड बाय ग्राउंड ग्लास ओपेसिटीज. राइट आंसर है इडियोपैथिक पल्मोनरी फाइब्रोसिस. इडियोपैथिक पल्मोनरी फाइब्रोसिस एंड ground glass opacities are often seen in idiopathic pulmonary fibrosis and other interstitial lung diseases. अगला क्वेश्चन है व्हाट इज द प्राइमरी एक्शन ऑफ बीटा ब्लॉकर. राइट आंसर है डिक्रीज हार्ट रेट. बीटा ब्लॉकर प्राइमरली ब्लॉक बीटा एड्रीनर्जिक रिसेप्टर लीडिंग टू ए डिक्रीज इन हार्ट रेट एंड कार्डियक आउटपुट. अगला क्वेश्चन है विच ऑफ इज ए हॉर्मोन नेफ्रोटिक सिंड्रोम. तो राइट आंसर है नेफ्रोटिक सिंड्रोम इज कैरेक्टराइज्ड बाय सिग्निफिकेंट प्रोटीनूरिया ऑफन एक्सीडिंग 3.5 grams per day. नेक्स्ट क्वेश्चन है a 65-year-old male present with a new onset of headache and blood vision. A blood test show elevated calcium level. What condition should be suspected? Right answer है primary hyperparathyroidism cause hypercalcemia leading to neurological symptom like headache and visual disturbance. नेक्स्ट है Which of the following is a common symptom of Parkinson disease? Right answer है bradykinesia or slowness of movement is one of the cardinal symptom of Parkinson disease. Next है what is the mechanism of action of warfarin? Right answer है inhibition of vitamin K epoxidase reductase. Warfarin works by inhibiting the enzyme responsible for recycling vitamin K, which is necessary for synthesizing clotting factor 2, 7, 9 and 10. अगला है which of the following is a common complication of diabetes mellitus? Right answer है diabetic retinopathy is common microvascular complication of diabetes affecting the eye and potentially leading to blindness. Next है a patient with history of chronic alcohol use present with confusion and ataxia. What is the likely deficiency? Right answer है thiamine. Thiamine deficiency is common in chronic alcoholic and can lead to Wernicke encephalopathy characterized by confusion and ataxia. Next है which type of hypersensitivity reaction is involved in allergic reaction to pollen? Correct answer है type 1. Type 1 hypersensitivity is an immediate allergic reaction mediated by IgE antibodies commonly seen in allergic rhinitis. Next, a patient present with jaundice and dark urine, which laboratory test is most useful for evaluating liver function? Right answer है prothrombin time. Prothrombin time is sensitive for liver function as the liver produce clotting factor that affect coagulation. What is the most common cause of community acquired pneumonia? मोस्ट कॉमन कोज क्या होता है कम्युनिटी एक्वायर्ड निमोनिया का? तो राइट आंसर है स्ट्रेप्टोकोकस न्यूमोनी. स्ट्रेप्टोकोकस न्यूमोनी इज द लीडिंग कॉज ऑफ कम्युनिटी एक्वायर्ड निमोनिया इन अडल्ट्स. अगला है विच ऑफ द फॉलोइंग मेडिकेशन इज कॉमनली यूज्ड एज ए फर्स्ट लाइन ट्रीटमेंट फॉर हाइपरटेंशन? हाइपरटेंशन में कौन सी मेडिकेशन है वो फर्स्ट लाइन ट्रीटमेंट है? तो राइट आंसर है डायूरेटिक्स। थायराइड डायूरेटिक्स आर ऑफन रिकमेंडेड एज फर्स्ट लाइन थेरेपी फॉर द मैनेजमेंट ऑफ हाइपरटेंशन। डायूरेटिक्स क्या करते हैं? बॉडी से एक्स्ट्रा फ्लूइड है वो बाहर निकाल देते हैं। जिस पेशेंट को डायूरेटिक्स देते हैं तो उस पेशेंट को बार बार पेशाब लगते हैं, इसलिए डायूरेटिक्स कभी भी नाइट में नहीं देनी चाहिए। डायूरेटिक्स है वो सुबह और दोपहर को ही देना चाहिए। विच कंडीशन इज करेक्टराइज्ड बाय ए sawtooth पैटर्न ऑन ए ECG? तो राइट आंसर है atrial flutter typically present with a sawtooth pattern known as F wave on an ECG. नेक्स्ट है विच ऑफ द फॉलोइंग इज कॉमन कॉज ऑफ सेकेंडरी हाइपरटेंशन? राइट आंसर है क्रोनिक किडनी डिजीज। क्रोनिक किडनी डिजीज इज ए लीडिंग कॉज ऑफ सेकेंडरी हाइपरटेंशन ड्यू टू फ्लूइड ओवरलोड एंड रेनिन एंजियोटेंसिन एक्टिवेशन। नेक्स्ट है विच विटामिन डेफिशिएंसी कैन लीड टू मेगालोब्लास्टिक एनीमिया? राइट आंसर है विटामिन बी। विटामिन बी डेफिशिएंसी कैन कॉज मेगालोब्लास्टिक एनीमिया ड्यू टू impaired DNA synthesis in red blood production. नेक्स्ट क्वेश्चन है व्हाट इज द कैरेक्टरिस्टिक फीचर ऑफ ग्रेव डिजीज? राइट आंसर है एक्सोथैलेमस। ग्रेव्स डिजीज इज ए ऑटोइम्यून हाइपरथायरॉयड कंडीशन ऑफन एसोसिएटेड विथ एक्सोथैलेमस। एक्सोथैलेमस क्या होता है? प्रोट्रूडिंग आइज, आंखें हैं जो बाहर निकल जाती है। अगला क्वेश्चन है विच लेबोरेटरी टेस्ट इज मोस्ट इंडिकेटिव ऑफ मायोकार्डियल इंफ्राक्शन? अभी अवस्थी एट्रियल फ्लैटर। ओके। Troponin is the most sensitive and specific biomarker for myocardial infraction indicating heart muscle injury. अगला क्वेश्चन है विच टाइप ऑफ फ्रैक्चर इज characterized by a break that occur at the right angle to the long axis of the bone? राइट आंसर है ट्रांसवर्स फ्रैक्चर। A transverse fracture occur when the break is perpendicular to the long axis of the bone. Next है which hormone is primarily responsible for stimulating ovulation? राइट आंसर है ल्यूटिनाइजिंग हार्मोन। LH सर्ज ट्रिगर ओवुलेशन इन द मेंस्ट्रुअल साइकिल। नेक्स्ट है विच ऑफ द फॉलोइंग इज द मोस्ट कॉमन टाइप ऑफ लंग कैंसर? राइट आंसर है एडिनोकार्सिनोमा इज द मोस्ट प्रिवेलेंट टाइप ऑफ लंग कैंसर स्पेशली इन नॉन स्मोकर। Often present with abdominal pain, current jelly stool and a palpable mass. Next, which of the following condition is associated with a cherry red spot on the macula? Right answer है Tay-Sachs disease. Tay-Sachs disease can lead to characteristic cherry red spot on the macula due to retinal degeneration. What is the primary cause of anemia in chronic disease? Right answer है impaired iron utilization. Anemia of chronic disease is characterized by impaired iron utilization due to inflammatory cytokines. Which of the following is a classic symptom of multiple sclerosis? Right answer है intention tremor. Intention tremor is a common symptom in multiple sclerosis resulting from cerebellar dysfunction. A patient with a history of heart failure present with sudden onset of dyspnea and cough productive of pink frothy sputum. What is most likely diagnosis? The right answer है pulmonary edema. Pink frothy sputum and sudden dyspnea are indicative of pulmonary edema commonly seen in heart failure. Which medication is used to reverse the effect of heparin? Right answer है protamine sulfate is an antidote used to neutralize the anticoagulant effect of heparin. What is the primary mechanism of action of statin? Right answer है inhibition of HMG coenzyme reductase. Option B. Statin primarily work by inhibiting HMG coenzyme reductase, a key enzyme in cholesterol biosynthesis. Which of the following is the most common cause of chronic cough in adults? Right answer है postnasal drip. Postnatal drip is the most common cause of chronic cough in adults, often resulting from allergies or sinusitis. A patient present with fatigue, pallor, or a smooth red tongue, what vitamin deficiency should be suspected? The right answer is vitamin B12. A smooth red tongue is a classic sign of vitamin B12 deficiency, which can also cause anemia. Which of the following is a classic sign of appendicitis? Right answer है make बनने point tenderness. Make बनने point tenderness located in the right lower quadrant is a classic sign of appendicitis. A patient present with unilateral facial drop, difficulty speaking, and weakness in the right arm, which artery is most likely involved? Right answer is middle cerebral artery. The middle cerebral artery supplies areas of the brain responsible for motor function and speech. Occlusion can lead to the symptom described. Which type of hypersensitivity reaction is associated with autoimmune hemolytic anemia? Right answer is type B. Type B hypersensitivity reaction involve antibody mediated destruction of target cell as seen in autoimmune hemolytic anemia. What is the primary treatment for hyperkalemia? Right answer is treatment for hyperkalemia may include insulin to drive potassium into cell, calcium gluconate to protect the heart, and sodium bicarbonate if acidosis is present. Right answer है osteoporosis. Uremic pruritus is a common symptom in chronic renal failure due to accumulation of waste products. बहुत ज़्यादा नेटवर्क इश्यू आ रहा है, शायद आपको वीडियो क्लियर नहीं दिख रहा होगा। क्या आपको वीडियो क्लियर दिख रहा है?